The measles outbreak in South Carolina has now become the largest seen in the U.S. in years. Officials say nearly 4 months after the first cases were reported, cases there are surging. According to the CDC, there have been 588 cases of measles reported so far this year. That's more cases than the U.S. typically sees annually. It's time now for our health roundup. And February marks the beginning of American Heart Month, a crucial period dedicated to raising awareness about heart health, the prevalence of heart disease. Chief Medical Officer of HERS and women's health expert, Dr. Jessica Shepard, joins me now to talk about ways to better your heart health. Dr. Shepard, thanks for being with us. Let's start with the importance of early detection. How is technology changing the way that doctors detect heart disease?
It's good to see you, Janae, on this cold morning. But yes, February is Heart Health Month. And this is really understanding that heart health is actually very common. And it's actually the leading cause of death for men, women. And that's about 1 in 4 deaths in the US. So I think that when we need to bring a little bit of awareness to the fact that it is the leading cause of death. Now, high blood pressure is the leading cause of heart disease. So now going to your question of how do we actually look for this? What are the newer technologies that we can use that can actually help both physicians and patients understand exactly where they fall into the dynamics of heart disease? A lot of that actually has to do with lab work. And I think that this is important because what we've used in the past is not to say that it is not good, but now we have things that are better, especially biomarkers that are very specified to heart disease, namely lipoprotein little a, looking at different characteristics of your cholesterol, and then also high sensitivity C-reactive protein, which has to do again with inflammation markers and how it impacts the vessels. And these are labs that actually can help a physician give a patient a way to look at what they're doing in their lifestyle and being preventative.
Okay, and so when we talk about lifestyle, we know that a healthy diet is so key to helping prevent heart disease. So what are some foods that we should be eating, Dr. Shepard?
Yeah, the foods that we're eating is not necessarily to take away and strip everything that you eat and take away all the pleasurable parts of eating. It really is looking at the nutrients that are going to be more dense and, again, contributing to a heart healthy portion of your life. Looking at nutrients such as magnesium, potassium, B vitamins, vitamin D, seeing if you're deficient in those, and then foods that are rich in omega-3 fatty acids as well as fiber.
And so let's talk about the importance of exercise. What types of exercise are most important when it comes to keeping your heart healthy? We hear a lot about cardio. Is that the solution?
Yeah, I think that there's a lot of, I guess you can say, emphasis on resistance training and weight training, but cardiovascular disease or cardiovascular exercise, rather, still very key to making the heart function under stress and then being able to see in the recovery period, meaning after exercise, how well your heart is able to adapt. And so that has to come with cardiovascular exercise because you're utilizing the heart to actually get you through that stressful period of exercise. And that's how you're going to build the muscle and increase vasculature and blood flow to the other parts of your body.
Okay, awesome. Thank you so much, Dr. Shepard. We appreciate you for being with us.